Bismillahir Rahmanir Rahim. The topic of housing is very important as many multiple choice questions come from this part. First of all, the definition of house and housing. What is housing? Housing is the provision of physical structure, shelter, and also the immediate surroundings and related community services and facilities. While the definition of a house is that it is a building for human habitation, especially one that consists of a ground floor and one or more upper stories. Housing is described as houses and flats considered collectively. Houses should be constructed and laid out as to promote physical, mental, and social well-being. For physical well-being, the house must provide enough space inside and outside to promote health by good light and ventilation and to prevent respiratory and contact infections. It must be constructed on firm and dry soil with subsoil water at a depth more than 3 meters. For mental well-being, the house should afford enough privacy and safety against the thefts. It should be situated at a place away from excessive noise and offensive odors. For social well-being, the size and construction of the house provided should be compatible with human dignity and social respectability, and the neighborhood should be congenital. The social goals of housing include shelter. The house should provide a sanitary shelter, which is a basic need. Secondly, adequate space for family life. That the house should provide adequate space for family life and related activities like preparation and storage of food, meeting, sleeping, individual activities, and basic activities. The adequacy of housing at this level has been found to have a direct impact on such things as worker productivity and family stability. The third goal of housing is to provide access to community facilities. A third element of housing is accessibility to community services and facilities such as health services, schools, shopping areas, places of worship, etc. Also, it should provide family participation in community life. Family is part of the wider community. Community is important to family in many ways. It can offer help in times of need. It is an important source of friends. Communities are able to pool their efforts and improve their living conditions. And lastly, economic stability. Housing is a form of investment of personal savings. It provides for economic stability and well-being of the family. So, the goals of housing are shelter, adequate space for family life, access to community facilities, family participation in community life, and provision of economic stability. Now, let us find out what are the housing conditions in the developing countries. As we all know, most of the developing countries have a problem of overcrowding and the living conditions are inadequate forcing the urban residents into slums. So the basic problem in the developing countries is the problem of overcrowding. Slums have awful living conditions and lack the basic housing and sanitation facilities. These conditions are compounded by malnutrition, lack of education, and inadequate medical and social services, and also the spread of communicable diseases. Infant mortality rates are high in the developing countries. There is high crime rate and other malicious behavior. Children may be abandoned by the parents due to poverty. These places are grounds for breeding social unrest. So generally, the housing conditions in the developing countries are very poor and are in need of improvement. On the other hand, how do you think are the housing conditions in the developed nations? It just comes to the mind of a person that the housing conditions in the developed nations should be very good. Actually, they were indeed very good, except that in the recent decades, the numbers of people without shelter have increased even in the developed countries. Some factors are there which forced people out of their homes. These factors are different from the major factor in poor conditions of the developing countries, which was overcrowding. On the contrary, in the developed nations, the factors are different. These are rising economic costs of living, unemployment, increased commodity prices, and the problem of migrants or refugees pouring in from neighboring countries. So, the public departments of these countries have to spend more on creating shelters for such people. The vulnerable people suffer the most and are turned homeless. As a consequence, a rise in mental health problems, substance abuse, alcoholism, and crimes is noticed. So, to summarize, the housing conditions in developing countries are poor due to the major problem of overcrowding. On the other hand, the housing conditions in the developed nations, although are still poor in the recent decades, but the factors involved in these are different. These are rising economic costs of living, unemployment, increased commodity prices, the problem of migrants or refugees coming from neighboring countries. Having said that, how can we determine that housing conditions are good or poor in any country? There are some housing standards that should be followed to determine the housing condition of a country. And these housing standards vary from country to country and are not confined to merely calculating the per capita space and floor space. Socio-economic characteristics such as family income, family size, composition, living standards, and actual factors are also taken into consideration in determining the housing standards. So, for the purpose of memorization for your exams, we enlist the housing standards. These are the site. The site of a house should be elevated from the surroundings. The subsoil water should be below 10 feet. Second is the setback. There should be an open space all around the house with no obstruction to lighting and ventilation. So the MCQ that comes into your exam is that the space around the house is called, and the answer is, it is called not veranda, not lawn, not anything else, it is setback. There should be an open space all around the house with no obstruction to lighting and ventilation, and this is called a setback. Third is the floor. The floor should be impermeable, easily washable, and kept clean and dry. The walls should be strong with low heat capacity. 9-inch brick wall plastered smooth and colored cream or white should be constructed. The roof, height of the roof should not be less than 10 feet. So height of the roof of a house should be at least 10 feet. Other standards are number of rooms. There should not be less than 2 rooms. This means that a house should have at least 2 rooms. Floor area of a living room should be 100 square feet for one person and 120 square feet for more than one person. So the floor area of the living room in a house should be, for one person it should be 100 square feet, and if there are many inhabitants in the house it should be 120 square feet, no matter how many persons are there in the house. If there is one person, it is 100 square feet. If it is more than 1, 2, 3, 4, 5, 6, 7, 8, any number, it should be 120 square feet. Windows, at least 2 placed at a height of not more than 3 feet above the ground. Why should the windows be not more than 3 feet above the ground? For cross ventilation. And the window area should be 1/5 of the floor area. Persons per room. This is an interesting standard. There should be 1 room for 2 persons. Okay, 2 rooms for 3 persons, 3 rooms for 5 persons, and 4 rooms for 7 persons. It seems that this is simple. 1 room for 2 persons, 2 rooms for 3 persons, 3 rooms for 5 persons, and 4 rooms for 7. So what is the problem in this? This is very simple. No, it's not that simple. When in exams an MCQ comes to you, it says that a family is there which consists of a husband, a wife, a small kid, a girl in class 3, a boy in class 7. So how many persons are these? These are 5. So how many rooms should be there in their house? You should remember and memorize these standards to be able to answer that for 5 persons there should be 3 rooms. And another scenario comes in which there are 7 persons, total of 7 persons. So for 7 persons, 4 rooms should be there in the house. Other than these standards, the kitchen should be separate for every dwelling, protected against dust and smoke, provided with storage space, water supply, drainage, and adequate lighting. So that's about the kitchen. And then there should be a sanitary privy in the house, readily accessible. Garbage and refuse should be removed daily and sanitarily disposed. Bathing and washing facilities should be exclusive to the house. And of course, water supply should be safe and adequate. So that was about the housing standards. Next we come to the topic of health hazards due to poor housing, or housing and its related health hazards. Housing is part of the total environment of man, and to some extent it is responsible for the status of man's health and well-being. So some conditions are established which are due to poor housing, and these are the following. The respiratory infections, for example, common cold, tuberculosis, influenza, diphtheria, bronchitis, measles, whooping cough, etc. Poor housing is related to respiratory infections. Secondly, skin infections spread very easily in poor housing conditions. Examples of this are scabies, ringworm, impetigo, leprosy, etc. Rat infestations are very common in poor housing conditions, and one disease attributed to rat infestation is plague. Arthropods are usually very common, like house flies, mosquitoes, fleas and bugs. Accidents. A substantial proportion of house accidents are caused by some defect in home and its environment. You can appreciate that usually in the news we hear or read about a house that has fallen due to its poor construction, and this causes serious accidents. Also, high morbidity and mortality is the cause of substandard housing conditions. Finally, the psychosocial effects. These effects must not be overlooked. The sense of isolation felt by persons living in upper floors of high buildings is now well known to have harmful effects. Often also people living in densely populated urban areas feel a similar sense of isolation, which may lead to neurosis and behavioral disorders. Now coming to the topic of overcrowding. It refers to the situation in which more people are living within a single dwelling than there is space for, so that movement is restricted, privacy secluded, hygiene impossible, rest and sleep very difficult. To find out if there is overcrowding in an area or not, we have to refer to the standards of housing, in which we have studied how many rooms should be there in a house for how many persons. According to this, overcrowding is the situation in which more people are living within a single dwelling than there is space for. It means that there are more people than should be there as a standard of housing. For example, if there are 5 people and 2 rooms, this is called overcrowding. So, what happens if there is overcrowding? Movement of people is restricted, privacy secluded, hygiene is impossible in overcrowded areas, and rest and sleep become very difficult. So, this is the definition of overcrowding. In general, the risks as regards physical health are clear enough. Infectious diseases spread rapidly under conditions of overcrowding. The effects on psychosocial health are not so clear, but there is irritability, frustration, lack of sleep, anxiety, violence, and mental disorders. Children are said to be more affected. In short, it is a psychosocial stress that leads to unhappiness and probably to psychosomatic and mental disorders. Overcrowding is a health problem in human dwellings. It may promote the spread of respiratory infections such as tuberculosis, influenza, and diphtheria. High morbidity and mortality rates are observed where housing conditions are substandard. In recent years, the use of indicators has become widespread for the measurement of quality of life. The indicators of housing may be classified as physical indicators, economic indicators, and social indicators. The physical indicators are based on floor space, cubic space, room height, persons per room, rooms per dwelling, and environmental quality, for example, air, light, water, noise, sewage disposal, etc. The economic indicators are cost of building, rental levels, taxes, expenditure on housing, etc. The social indicators are further classified into indicators related to prevention of illness, indicators related to comfort, and indicators related to mental health and social well-being. The indicators related to prevention of illness were proposed at an interregional seminar on social aspects of housing organized by the UN in 1975. These are the frequency of illness due to inadequate sewage and garbage collection, frequency of illness associated with contaminated water source, the frequency of insect-borne diseases, the frequency of illness due to overcrowding, frequency of illness due to accidents, frequency of illness due to proximity to animals, and access to medical facility. So these are the social indicators related to prevention of illness. Second are the social indicators related to comfort. These include thermal comfort, acoustic comfort, visual comfort, and spatial comfort. Third and last are the social indicators related to mental health and social well-being. These are frequency of suicides in neighborhood, neglected and abandoned youth in neighborhood, and drug abuse including alcohol in the neighborhood. So these are the indicators of housing. Once again, indicators of housing are the physical indicators, the economic indicators, and the social indicators. Another important topic is humidity. Atmospheric humidity or moisture content of air is generated from large watery surfaces which are exposed to the atmosphere. Moisture is also added to air by living animals and plants due to their constant discharge of water vapor from the lungs or leaves. The moisture content of air can be expressed in different manners. Let's look more closely at the concept of humidity, which refers to the amount of water moisture or water vapor in air. Since there are many ways to express atmospheric water vapor content, there are several meanings for the concept of humidity. There are two types of humidity, namely absolute humidity and relative humidity. The first type of humidity we'll take a look at is absolute humidity. Absolute humidity is the weight of water vapor in a unit volume of air, usually expressed in grams per kilogram or grams per cubic meter of air. So, humidity is equal to mass of water vapor divided by volume of air. Absolute humidity represents the water vapor density or mass per volume and normally is expressed as grams of water vapor in cubic meter of air. For example, if the water vapor in 1 cubic meter of air weighs, let's say, 25 grams, then the absolute humidity of air is 25 grams per cubic meter. The second concept is relative humidity. Relative humidity is the percentage of moisture present in air, complete saturation being taken as 100. The best range of relative humidity is between 30 and 60%. While relative humidity is the most common way of describing atmospheric moisture, it is also unfortunately the most misunderstood. The concept of relative humidity may at first seem confusing because it does not indicate the actual amount of water vapor in air. Instead, it tells us how close the air is to being saturated. In other words, relative humidity is the ratio of the amount of water vapor actually in the air to the maximum amount of water vapor required for saturation at that particular temperature and pressure. It is the ratio of the air's water vapor content to its capacity. Thus, the relative humidity is equal to the water vapor content divided by the maximum water vapor capacity. We can think of the actual water vapor pressure as a measure of the air's actual water vapor content, and the saturation vapor pressure as a measure of air's total capacity of water vapor. Hence, the relative humidity can be expressed as the actual vapor pressure divided by saturation vapor pressure multiplied by 100. Relative humidity is given as a percent. Air with a 50% relative humidity actually contains 1/2 the amount required for saturation. Air with a 100% relative humidity is said to be saturated because it is filled to capacity with water vapor. Air with relative humidity greater than 100% is said to be supersaturated. As we have mentioned earlier, the best range of relative humidity is between 30 and 60%. If relative humidity exceeds 65%, the air inside the room feels sticky and uncomfortable. Better ventilation serves to lower such humidity, while relative humidity below 30% is also unpleasant because permanent exposure to very low humidity can cause drying of the nasal mucosa, which may predispose to infection, for example sore throat or cough. So, to compare and contrast, absolute humidity equals mass of water vapor divided by volume of air. It is the weight of water vapor in a unit volume of air. On the other hand, relative humidity is the ratio of amount of water vapor actually in air to the maximum amount of water vapor required for saturation at that temperature and pressure. In the form of a formula, we can say that relative humidity equals water vapor content divided by the maximum water vapor capacity, and the best range of relative humidity is between 30 and 60%. Finally, the measurement of humidity. Atmospheric humidity, or the moisture of air, is generated from large watery surfaces exposed to the atmosphere. Moisture is also added to the air by living animals and plants due to their constant discharge of water vapor from the lungs or leaves. How can we measure humidity? The instrument used for measurement of humidity is called dry and wet bulb hygrometer. This is the most widely used instrument for measuring humidity. It consists of two similar thermometers, a dry bulb thermometer and a wet bulb thermometer, mounted side by side on a stand, as this picture is showing. When readings of both thermometers is the same, this indicates that the atmosphere is 100% saturated with moisture. Let's take a closer look to the dry and wet bulb hygrometer. As we said earlier, it consists of a dry bulb thermometer as shown in pink color here, The dry bulb thermometer measures the ambient air temperature, while the wet bulb thermometer, indicated in blue color, this wet bulb thermometer is similar to the dry bulb thermometer, except that it has its bulb covered with a muslin cloth kept moist by a cotton wick, which dips in a reservoir of distilled water. This thermometer records air temperature as influenced by the rate of evaporation from the muslin cloth. The drier the air, the greater the rate of evaporation, and the lower would be the readings on the wet bulb. As we said earlier, if the readings on both thermometers are the same, this indicates that the atmosphere is 100% saturated. Another instrument is used to measure humidity, and it is called the Sling Cyclometer. This instrument has a dry and a wet bulb thermometer mounted side by side on a metal strip, which is fixed on a wooden frame. So the difference between the dry and wet bulb hygrometer and the Sling Cyclometer is that in the dry and wet bulb hygrometer, the two thermometers are mounted on a wooden frame, while in the Sling Cyclometer, these two thermometers are mounted on a metal strip which is further fixed on a wooden frame. The frame has a handle on the side which acts as a pivot on which wooden frame can be rotated. The wet bulb is kept wet by a piece of wick which soaks water from a small cylindrical water container. Once ready, the instrument is whirled standing with the back to the sun at the rate of 4 rotations per second. The two thermometer readings are used to determine the relative humidity of air using suitable tables and charts. So, to summarize, humidity can be measured with the help of instruments like dry and wet bulb hygrometer or the Sling Cyclometer. Thank you.